If you had the opportunity to save someone's life, would you? If your life was in need of saving, wouldn't you want them to save yours? In the grand scheme of things, it doesn't take an individual much to save a life, you just need to be willing. Organ donation has been a thing that's interested me greatly, and I want to pursue a career in the medical field, so I think it's important that I'm knowledgeable about these things. On top of that, I myself am an organ donor, and I've also worked in a hospital where I can see the positive effects that a successful organ donation can have on people. Unfortunately, death is inevitable and everyone dies, but if you can prevent certain deaths by donating organs, why wouldn't you? Anybody can become an organ donor. It's just a matter of sharing what you already have for the better of somebody else. Becoming an organ donor gives individuals the opportunity to save lives. Firstly, I will talk about the great need for organ transplants and donations. Secondly, I will discuss the countless people on the transplant list. And lastly, I will conclude with how easy it is to become an organ donor and the positives that come with that. The need for organ transplant and donations are rapidly rising. According to an article written by Jim Abona in 2008, the demand for organ transplants has rapidly increased all over the world during the past decade due to the increased incidence of vital organ failure. The number of people on the waiting list are getting longer, and the number of donors are lag significantly behind. Some people die on the transplant list, and some people spend weeks, months, even years in the hospital waiting for a perfect match, and others just make appointments and go in and out into the hospital for treatment plans. The organ shortage crisis has deprived thousands of patients of a new and better quality of life. With more people in need of organ transplant, the list grows. According to an article written about organ donation statistics in 2020, there are nearly 112,000 men, women, and children on the transplant list as of March 2020. Approximately every 9 minutes, a person is added to the list. And also approximately 22 people die each day on the transplant list due to not finding a match. And annually, that death rate is 8,000 a year. Last year, there were 39,718 transplants performed. About 93 people received a transplant a day. And believe it or not, 93% of adults in America support organ donation, but only 60% of them are actually donors. People who are on an organ waiting list typically have an end-stage organ disease that significantly impacts their quality of life, or could potentially end their life. Receiving an organ can improve these people's quality of lives greatly. As the transplant list grows, it is imperative for more people to become organ donors and to assist those in need. Becoming an organ donor is easy, and it provides one with an opportunity to help others. According to an article written about the importance of organ donation in 2019, when you register for your license or are renewing your license, all you have to do is check a box saying that, yeah, I want to be an organ donor. Another way you can register is with one simple phone call to your local state health organization. Becoming an organ donor is a scary concept, but the positive retributions outweigh the negatives. For example, one person doesn't need 2 kidneys to live, but there's also a person in the hospital right now with 1 kidney that's not working. They have a life, they have a family, they have aspirations, and they also have 1 kidney that's not working and is failing. What if you gave your kidney to them and helped salvage a life and save a life, and you can still live perfectly fine, but then that's just the best of both worlds right there. One organ donor has the potential to save 8 lives. One organ donor also has the potential to improve 60 lives in the eyesight of 2 people. When an individual donates an organ, the act goes beyond touching the lives of those affected. The act of donating an organ touches the lives of families and friends of the recipient in that situation. Organ donors give people on the transplant list a second chance, more time, and a better quality of life. As the numbers increase on the list and the demands for donations, the donors need to increase as well. Becoming an organ donor increases the individual's opportunities to save lives. Everyone already has instilled in them what is required to become an organ donor. Mankind needs to come together and protect what everyone holds most precious to us, the gift of life.